Okay, thank you, Tom and Marcia, for asking me to come today. I'm excited to share a little bit about what we're doing. And I decided to start with why Cypress. I think that's why I'm here, so why Cypress? We're new with Cypress. We became a client in October of 2015. And the reason we chose them is Cypress is the total package. I spent countless hours and days in trying to organize a really great benefit plan that has cost containment measures within it, not just for the employer, but for the employee. And many people, many of the very smart people that I've met as I've been networking and trying to figure out how to put this all together kept saying to me, "Are you a client of Cypress? Are you a client of Cypress?" And I kept saying, "Who's Cypress?" And once I finally had the conversations with Marcia and Tom, I figured out that they are already doing everything that I have been trying to do for months and years. So anyways, I decided to be partners with them. And so here we are. Top 4 reasons that I choose Cypress. They take a very comprehensive approach to risk management and disease management. Highly proactive in claims adjustments through their Argus claims review. Highly scrutinized vendor partners, and they are cutting edge with innovative solutions for cost and risk management. Knowledgeable staff that offer very high level of customer service. I'm impressed every time I have to contact somebody at your organization. And I'm just going to give a quick shout out to Mary Flannery and Greg Berth. Their knowledge and attentiveness to our individual needs as an employer it completely exceeds expectations. It's unlike no other. And they continue to put up with my incessant need for data. So anyways, Plank Enterprises, we're a small family-owned business. We're located in Eau Claire, Wisconsin. And we have 3 small manufacturing companies and then an online distribution company. At LDPI, we're a luminaire manufacturer. We provide LED lighting products and control systems for industrial applications. LPI, we manufacture custom-engineered personnel lifting systems and material handling solutions. And at ProCise, we are a contract manufacturing company, and we manufacture fabricated parts for original equipment manufacturers. And then at Badger Industrial Supply, it's an e-commerce business with industrial supplies. We have 2 locations. We have about 140 to 160 employees is what we range. In 2015 and 16, we had 124 eligible employees, 80 of which opted into our benefit plan. So we have about 165 belly buttons. Out of the 80 employees that opted into our plan offerings, 33% elected our high deductible health plan and with HSAs. I like to highlight that 33%, only 33% took our high deductible health plan. To me, that's important. Everybody has a different way of providing their benefit plans, but I'm very focused on providing high quality, dedicated care that promotes wellness and changing behaviors through education and incentives, versus what I feel is an ineffective alternative, and that's cost shifting. Cost shifting alone decreases utilization, and in my opinion, long term, it leads to poor health. So I'd like to start out with this slide because this is what we looked like every year when it would come time for our renewal. It's really what finally led me to lead the organization to do something totally different. We were on a fully insured plan for about 6 years, and every year we would have to increase premiums to our employees. Same story, same song and dance probably everybody in the room here has had to deal with. I would request claims data kind of to try to justify that increase every year, and they wouldn't give it to me. So nothing that we were doing seemed to lessen our chance for those double-digit increases. And so I finally realized that we didn't have an avenue for managing the costs. So we were passive, like many organizations are today. We just pretty much accepted the legacy delivery approaches and the payment structures that the majority of the large vertically integrated systems force on us, all which produce erratic quality and unsustainable costs. So these are real numbers. This is kind of when I had had enough. In 2013, we had experienced a 160% increase in our premium costs over a 6-year period, and that was extremely significant. We couldn't do any more cost shifting, and so that's when I was on the fast track to really find partners to help us help us deal with the struggles. So as I was kind of searching out partners, everything that was being introduced to me were programs and solutions that typically are implemented at very large organizations. And so I kept thinking to myself, how at a very, very small organization am I going to be able to do any of these things? But I finally realized that we couldn't afford not to. So we believe that there are 4 important platforms for cost containment. Number 1, being self-insured. One of the beautiful things about being self-insured is that you have access to data, and with that data, you can obviously identify and stratify your risk. On-site, near-site, proactive primary care. Access and availability to primary care is declining. Fewer med students are entering that discipline, and if people aren't using primary care, they're avoiding preventative care, and it drives them eventually to turn to high-cost alternatives, such as urgent care, ER, specialty care, so on and so forth. Caseloads of 3,000, patients can result in abbreviated interactions, and I think you've all heard about the 7-minute average, and so on and so forth. And so they typically go to the high-cost alternatives. Value-based purchasing and price transparency. Healthcare costs too much, and it's proven that there's no correlation between price and quality. Prescription drugs are an issue. I'm not going to go into that. I think there'll be other people here this week or today and tomorrow to do that. But we partner with providers that focus on value, and I'll speak a little bit more about that. And we also encourage consumerism. And typically employees procure their health with very limited knowledge of the healthcare delivery system, and often they make choices purely on habit and convenience. Consumer-driven programs and behavior change accomplishes what cost shifting doesn't. So that's what we like to focus on, and we think that employers are key to that change. So in 2013, we made the strategic plan to be fully committed to a consumer-driven plan design, and the first thing that we did is that we changed our financing model. We went to self-funded policy, and we joined a group captive. We partner with Pareto Captive Services, and I believe they're here this week too. I'll let Andrew toot his own horn on those things, but the one reason that we chose Pareto over some of the other options that we looked at is they have a very high priority on health population management and wellness of your employees. So we increased our deductibles, co-insurance, out-of-pocket increased. I'll let you guys kind of read through those. But the one thing that we did is we maintained our premiums. And we've maintained our premium for our employees for the last 3 years. We have not increased anything for them. We constructed a 1,100 square foot on-site clinic, and we offer free primary care, free physical therapy. We require everybody to have an annual adult comprehensive exam with blood work. And we do that so we have biometrics of our total population, and then we can start to develop our plan design based around specific needs of our demographic. We have care coordination programs, dialysis, oncology, obesity, and diabetes, and we do some direct contracting, have wellness program, and we also use a price transparency tool. Some of the benefits for our employees are no copays if they use primary care, what we call our primary care medical home clinic, and we have an on-site and a near-site option. And they don't just have copay, they don't have any, we don't charge them at all. So all of that's free. Average appointment time is 20 to 30 minutes. They have phone and email access to physician, online scheduling. We offer anywhere between a 30 to 50% differential on our premiums, depending on what you qualify for. And our employees are paid during their on-site clinic visits, and we offer discounts for procedures and lab costs. So this really is a summary of our plan. Sorry that it's kind of small, but a couple of things that I just want to highlight on the first section, premiums. And these premiums are for primary care medical home participant, non-tobacco user. The employee contribution for our traditional plan is 25 to 30% of the premium, and then for the high deductible plan, 22 to 30% of the employee is the employee contribution. And it's my understanding that that's pretty industry standard. I checked that with Cypress, and that we're kind of right in the middle of the road with that. There's people that offer have their employees contribute less and people more. So deductibles are pretty standard, you know, the 80-20 in network, 60-40 out. Few things we charge a $300 copay for the use of an emergency room. We charge a $100 copay if they use the PPO network and they go outside of our on-site, near-site care providers. We charge $200 copay for a specialist, unless they're referred to the specialist from our primary care physician. And then a $100 copay for urgent care office visits. So if you're an employee of ours, this is kind of, these are your options. You can use our on-site, near-site clinic, and everything's free. And when I say specialty care, urgent care, ER, there are many situations where employees or people will choose to go to specialty care, urgent care, and ER, and it's not necessary. It fits within the scope of primary care. So what I'm saying is if they use the primary care that we've provided for them, oftentimes they will get the care that they need provided. If they choose another provider, preventative care, obviously that's that's zero because of ACA. But these are their out-of-pocket costs if they choose to go to another provider. So because we have our data, we can identify our top 5 risk factors, and these are our 5. We are 65% of our population is overweight and obese. And I say that we're from Wisconsin, and so we like cheese and crackers and the beer and Packers. So, but the reality is that that's very close to national average. National average is 67%, and so probably all of you employers out there, you have that same percentage probably within your organization or higher. 25% of our population has tested positive for nicotine, and so on and so forth. So we recognize that a large percentage of our population was overweight and obese. So in 2015, we implemented Best Life Obesity Plan, and we had 22 voluntary participants that have lost over 550 pounds in the last 5 months. We partner with Wellness Program, and I guess just what I really wanted to show you here is that we understand our demographic, and we know what our exposure to risk is. And I think our organization has made really some significant strides. In 2014, we had 34.5% of our employees or covered beneficiaries were in the low-risk category, and in 2016, we have 50.4% of our demographic into the low-risk category, so that's a significant improvement. And I guess the point I wanted to make is that by implementing programs that allow you to obtain that aggregate data and understand your risk, that's when you can start to control health in a meaningful way. And the results of that, obviously, is controlling costs. This is just one other slide to show a little bit of the impact. And I'll just kind of go right to the bottom portion. 2013, we had to 15, we had a 6.5% improvement in the triglycerides, moving to the low risk category, and then so on and so forth with the moderate and the high. So the impact of our wellness program, I think this is one of probably the most impactful slides. After the first year and a half of setting up our primary care home clinic, we saw a 74% increase in primary care expenses, which we would expect to see, and that's what we wanted to see. But the best part is that we saw a 69% decrease in inpatient claims, 61% decrease in specialty care claims, an 81% decrease in ER and urgent care claims. And we typically run around a 99% generic substitution rate and 96% generic utilization rate. So our total loss ratio over the last 3 years since implementing is less than 40%. From 2012 to 2014, we decreased our cost per covered life by 36%. And with those savings, we were able to add more wellness initiatives, more programs, and we increased our profit sharing to our employees, and we told them that that's why we did it. So the cost of our program, it's right here. This is what it is. What I like to show is that, that annually for us, for a family, is about $11,000 per year, and compared to what Kaiser says is about $20,000 for a family. And Kaiser's number are premiums only. Our numbers at Plank Enterprises include all of our costs, all in. On-site clinic, all of our premiums, employee and employer, claims, our captive capital, our fees, our commissions, our wellness program, our rewards, our incentives, everything. Summary of our plan: we're self-funded with a group captive. We have a primary care medical home. Our premiums have been unchanged for 3 years, and so on and so forth. We do have a price transparency tool that our employees use. We encourage them to use with an advocacy program that's attached to that. We work with Aletheus. We offer cash rewards for choosing the centers of value, and we identify what those centers of value are. We have an online reward store for completion of all of the wellness program activities. We do direct contracting and bundled pricing. We work with Novo Health. Kurt's here. Kurt will be presenting, I think, tomorrow, and so they have a great model, and they're a great partner. And then we have, a lot of effort put into our wellness program, the medically managed weight loss program, and then free 6-week kickstart for personal training. So I asked Pareto to if they would share a little bit of data. I think self-reported data is really cool, and it's fun for me to get up here and tell our story, but I think sometimes where the rubber meets the road outside of saving money for the employer and the employee is, how do we compare? How do we compare to other people in other employers that are our size, other employers within our captive group, so on and so forth? Is it really paying off? And we're the circle in the bottom, and it shows that we have less than 40% total loss ratio. And then on the far left, that's a scoring system that they use. And this slide just shows our aggregate increase and kind of where we're at. So collectively, over the last 3 years, we have had less than a 3% increase. So I'm really optimistic, and I think that even now with Cypress, we have an opportunity to even improve that even more. So I'm going to close by saying this. Last but not least, I think, and most importantly, our employees and their families really value our program. We've made they have made a significant investment in being a better, healthier version of themselves. They participate. We asked them to participate in a study, so they voluntarily participated in a success case method study that was conducted by researchers at the University of Wisconsin-Stout. And the study measured the effectiveness in containing and controlling costs for them, improved access to care, overall satisfaction as it pertains to a customized personal experience. The study revealed 0 low successes, with 90% of the respondents stating that their health benefits were inexpensive, and 100% want our programs to continue. That's it. Any questions?
Thanks, Natasha. Maybe what we'll do is once our other two speakers come up and give their presentations, you can ask whatever questions that you care to. But we love Natasha as a client because she's doing all the right things. And when we talk about all of the options available, you saw the list. Well, maybe you didn't see the list if you're sitting in the back, but there's an awful lot of things that she's doing, and the results have been lowering the costs. And that's really what it's all about. So we're proud to have her as a client. Next speaker is Gary Kyle from American Heritage Railways in Omaha, Nebraska. And Gary, as he says, has an insatiable passion for providing his small company with an excellent health benefit plan at an affordable cost in an ever-changing healthcare landscape. Following 30 years with Albertsons, Inc., that included a degree in management of human resources, 22 years of grocery store management, and experience with benefit and labor contract administration. In 2006, Gary joined American Heritage Railways, the country's premier tourist rail operator and the industry expert in rail-related special event management. How many people have done rail-related special event? I have not, so I'm going to take advantage of that for sure. His initial role as HR manager for the Durango and Silverton Narrow Gauge Railroad introduced him to the self-funding challenges of a small company health plan, and soon led to him becoming the HR lead for American Heritage. So during the last 10 years, the team at AHR has implemented a stable and financially solid self-funded health plan with a consumer-driven high-deductible health plan, and Gary's here to tell you about it. So please welcome him. Just advance that way, and Martha's going to tell you when there's 5 minutes left.
Okay. Thanks, Tom. It's a privilege to be here and share with you today. A little bit about American Heritage Railways. American Heritage is our parent company. We are a tourist railroad company, and so we operate tourist railroads around the country. The first was the Durango and Silverton. In 2000, we added the Great Smoky Mountain Railroad. Started a licensing company called Rail Events in 2002. Decided to get into the hotel business, and so we bought a Victorian hotel in Silverton, Colorado. It's under renovation now. If any of you watched the movie Money Pit, we're figuring out what that's like, and it's kind of an interesting operation there. And then in February, we closed on a purchase of the Mount Rainier Railroad and Logging Museum in Mineral, Washington, so we're pretty excited about that. During the interim, we've had management and consulting contracts with a variety of rail clients, Texas State Railroad, Cumbres and Toltec Railroad. We're actually involved with Jose Cuervo in Mexico, setting up the tequila train. So lots of fun stuff that goes along with rail management. Yeah. It's an interesting company. We've got an interesting culture. It's very unique. It's heavily industrial, primarily male-dominated. I tried to figure out a way to phrase this, but we're very mature. A challenging demographic. The plan was started back in 2000, and with that, it was when we acquired the Great Smoky Mountain Railroad, we needed a health plan. We needed a health plan that was going to cross states. We had a railroad in Colorado and one in North Carolina, and so we looked at what to do with that, and self-funding was really the direction they went to go. It covered 119 employees and dependents. It was self-funded and very traditional. It was that 90-10 PPO plan, had a $250 deductible, $10. Anybody remember those days? Hey, anybody still on those days? Yeah, gosh, not for us. Anyway, that's what it looked like for us. In 2000, well, actually, let me give you a little bit of cost. So the total claim cost that year was about $200,000, and you can see the split. In year 6, and that was in 2006, that's when I joined American Heritage. One of the things they asked me to do was to look at the plan and say, hey, where are we at and what's happening? And I want to tell you, they didn't ask me that because things were going really, really well. So that's the first indication that maybe there's a problem with it. We were still covering 119 employees. There had been no plan design changes in 6 years. Our specific deductible had grown a bit. The attachment had grown a lot. And so when we looked at claim cost, our medical claim cost was up 107%. Our prescription costs were up 266%. Our total claim costs were up 130%, and we were really up. And so when we really started looking at that, we had a plan at that particular point that was kind of unsustainable. And so we really began to think, well, what are we going to do? And it was raining really hard, and we needed an umbrella. And so oftentimes when you are in that situation and you think you need to do something, well, you do something. And so we began to look at doing something that year. And so as the first thing that we did was say, hey, we need to do some strategic planning. We need to think about where we're going with this. And so the first thing we did was to say, hey, we really want to provide quality health care. We had a commitment to doing that, and we wanted to maintain that option. The second thing we needed to do, though, was we needed to change plan design. We'd gone 6 years with absolutely no change in plan design, and at the time frame of what was happening in medical care, that really was not a great option. And so we had to make a commitment that we wanted to stay current with plan design. We had to educate our employees to be better consumers of health care. Because, you know, when you have a $250 deductible and a $10 copay at the office visit, there's not a lot of incentive to be really concerned about what was happening with healthcare costs. And quite honestly, our employees weren't. And they didn't have any reason to be. And so we had to look at potentially changing that. And then the last thing we had to do for our company is we had to decide what are going to be the limits in terms of what we can afford to spend on healthcare, and then how do we put in cost containment procedures that are going to allow us to be there. And so those were challenges that we needed to look at during that period of time. Now, those are really great things, kind of lofty goals that we really looked at, and we weren't really quite sure what to do. And so that first year, we decided we needed to throw something out there. And so mid-year, we increased the deductible. It sounded really good, okay? And honestly, it had almost no impact, but the small piece that it did is that it let our employees know that, hey, healthcare is changing. Okay, and things are going to be looking at changing. And so while that was really kind of a crazy, dumb thing to do, at the end of the day, it started a process that was pretty valuable for us, because what we really had to do is to say, hey, can we afford to continue to be self-funded? And what we decided at the end of 2006 was the answer to that was no. And so we did one of those things that probably not lots of companies do, but we had to go back to the dark side. And so in 2007, we went to a Cigna fully funded plan. Gosh, I just hate telling you that, okay? But it allowed us to do some really good things, because you remember our plan cost was $707,000 in 2006, and we were able to stay with a $721 cost that following year. And that was really important to us because we needed to stabilize things. But what it also allowed us to do was to go to a high deductible health plan, and I appreciate the comments about the fact those ASO plans, and we were on one of those ASO plans, and so kind of nodding, yeah, we were there. Well, we knew what that was like, but it allowed us to put together that high deductible plan. You can see that we had a health reimbursement plan with that. We also had a secondary plan, and we kept the PPO plan. But the one thing we did was we said, well, if you want to go on the high deductible plan, we're going to still offer that at no cost. So there was no employee premium to move to the high deductible plan. But if you wanted to stay on the old PPO plan, that 90/10, $250 deductible, you were now going to have a premium, and it was going to be about $125 a month. And what ended up happening is 80% of our employees switched the first year. And it was like, wow, that really worked. That was pretty impressive. And so in the end, while we were still in the dark side there, it did do some really good stuff for us. So as we head into year 2 with that, one of the things that we figured out really quickly was that, when Cigna does that, they're going to price it really good that first year because they know they've got you the second year. And so you remember that $721 cost that we had in 2007? Well, it went to $843,000 the next year. And so as we looked at that, it was like, wow, that didn't work so well either, because now we're not even controlling cost. But as we began to see some things change. And so the first thing we did was we continued with the plan. We introduced an employee premium on the high deductible health plan. We started to talk to our employees about why this was important to them and why it really had an impact on what was going on with them. And so in 2009, things had started to stabilize again for us. So we had no change in plan design, no premium increase for employees, and we started to prepare to move back to self-funding in 2010. And it gave us 3 years that we had an opportunity to kind of rethink what we were going to look at doing. And so one of the biggest things was, as the plan design had started to stabilize, was to say, well, what do we want to do in 2010? So we came back. We went back to the same specific deductible we had before, almost the same aggregate that we had before, and we started to say, hey, we really need to introduce some change. And so the first big change that we did was to introduce interactive health solutions. They provided on-site biometric screenings, they did a health risk assessment, and they assigned a health score and goal. And the idea was that for our employees, you can become a better consumer if you actually know what's going on with your health. So rather than waiting for something to be wrong and then just going wherever you needed to go to treat it, we want to give you some information on the front end to really begin thinking about how do you stay well. And IHS helped us look at doing that. We began to talk about the fact that things were going to change, and they were going to change routinely. And we began to talk with our team about the fact that change is not necessarily a really terrible thing, but something that we're going to do on a really planned basis with an idea to help us get through this together. So in 2011, we kept the same plan design. We introduced a premium differential for the first time based on your IHS participation and based on your health score goal. And it was up to about a 50% differential in terms of premium cost. We changed PBMs. We've been with ScriptWorld. We moved to MedTrax, and that probably wasn't a huge deal, but it allowed us to do some things like introducing step therapy. Our prescription cost is actually built into the deductible, so it's not a separate part of that. So our employees had a huge interest in finding out about prescription costs, because in January, they were paying all of the cost of the prescription. And so all of a sudden, it really made a significant difference for them to think about that. We introduced Virgin Health Miles. It was really kind of a pedometer-based program, an activity-based program. We really kind of wanted to get into the wellness. And sometimes you do some okay things and you do them for all the wrong reasons. So like, I really love these really great lanyards here that you gave it, because what you really know is that coffee stain I got in the airplane this morning, well, it kind of hides it right here. And so sometimes, you know, things like wellness programs do that for you. You know, you do something because it looks really good and you're really not quite sure what the result's going to be, but you do it anyway, and we were kind of doing some of that. Now, that's not to denigrate Virgin Health Miles. It was a great program, but what we really did was we incentivized all of the employees who were already doing that anyway. And we did it for several years. In 2012, we dropped the PPO plan, and we really went to a one plan design. We, at that point, only had a couple of employees that were still kind of carryovers to that, and so our employees had really embraced the high deductible plan, and so we just didn't really see a need to carry and administer two different plan designs. We introduced U.S. imaging. And while I would tell you again, that was one of those things we did that had almost no impact, because remember, we operate in Bryson City, North Carolina, and Durango, Colorado, and now Mineral, Washington. And so that standalone radiology clinic was a really great idea, and we wanted to really look at addressing some of those costs. And the problem was that the closest standalone radiology clinic was 150 miles from where our employees were at. And so again, not a bad idea, but not really impactful. And I guess part of the reason I'm telling you that is because we've done some things, and some of them have been very good and they've worked really, really well. And there have been some that, you know, quite honestly, weren't all that great. But it's okay, and part of the reason was because we really wanted to continue to look at addressing issues, and what's allowed us to do is to really begin to think through what was happening with those. 2013, we moved from the health reimbursement account to a health savings account, made quarterly company contributions to that in the same amounts. We introduced cancer care for the first time. One of the things that's true when you have a small plan design is that when you get a large oncology claim, it's really impactful on your plan. And we began to see some of those. And so I know you're going to hear about cancer care later, and cancer care was a great program for us. Remember, we're in small towns, not lots of great resources, and it allowed us to begin using the best facilities all over the country to treat cancer. And it was really a great program for us. We introduced Compass Professional Health. They actually call it your Health Pro. Compass is a great program. I would tell you that out of all of the things that we've done, our team would probably tell you that that's their #1 favorite thing we've done, because it gave somebody to be an advocate for them, who would do price transparency for them, do bill review for them, really be an advocate for them. And remember, we've got generally a blue-collar clientele or employee base, effectively in small towns, and so for them to be able to have somebody that was really their advocate was really important for them. 2014 and 15, we moved the specific deductible up. We considered Consult-A-Doc. And again, I just want to tell you some of the things that we looked at. We actually didn't go with it, but we wanted to look, hey, is telemedicine something that we've got an opportunity to look at? I know that we're going to have a presentation on medical tourism, and we looked at Satori at that particular time. And honestly, our current TPA at that time said, well, we won't work with them, so I kind of killed that pretty quickly. But in the end, we went through that process because we thought it was important for us to really look at considering that. We attended the Pareto Captive meeting through our broker, Thomas McGee, and it was incredibly valuable information for us. It introduced us to reference-based pricing. It introduced us to PBM contracting. There were a lot of things that we learned at the Pareto conference that, quite honestly, we didn't know about. And so I know you're going to hear Andrew tomorrow, and I think, and I would tell you that we were incredibly impressed with Pareto. We engaged Springbuck as a result of being at that conference and hearing about Springbuck. One of the things that was very important to us was to figure out, well, how can we predict what our costs are going to be down the road? And as we listened to the Springbuck use of data and looked at it in terms of a predictive modeling piece, we were impressed with that. And so we've gone with Springbuck. As a matter of fact, I just got an email last week that our data's been loaded, and we now have that first ability to begin kind of looking at where we're at and what opportunities we have to be going. 2016, so what's happened now? We introduced MedTrack Specialty Select program. For some of you, you may be concerned about what's happening with high drug specialty costs like PSK9s and some of those kinds of things. And so we put a program together in terms of Specialty Select with MedTrack to specifically address some of those high cost prescription dollars and what we're going to cover and what we're not going to cover, and specifically look at addressing those. And so I'd suggest if that's an area that you haven't looked at with your PBM, you might want to do that. We changed TPAs to Cypress. We had a number of reasons in terms of moving with that, not the least of which that we weren't Aetna fans anymore. And so you can probably guess who our TPA was at that particular point. We did TPA evaluations in 2015, and we had Julie come out, and she did a great job of telling us about Cypress. We've been incredibly impressed with the Cypress team. Tina's done a great job. As a matter of fact, I want you to know, if you know, Tina is the head wizard. I want you to know Tina. So that is her new title from American Heritage. She is the head wizard. Sharon, Julie Peterson, all of the folks who've been involved in our setup have done a great job with us. We really appreciate that. We've been a challenge client, I know, and at the end of the day, we push the envelope because there are things that we think are important, and they've been very accommodating in terms of doing that. One of the things that really helped us with Cypress is that we made the full jump this year to go to RBR. So we are on a complete reference-based pricing program this year. Cypress was one of the TPAs that would allow us to do that, and there were lots of TPAs that tried to talk us into going to a medical bill review first, and if you really ought to look at, you're really not sure what you're getting into, and you probably shouldn't do that, and for our broker knows, and Cypress is learning that we're impulsive sometimes, and so we jumped into reference-based pricing. We're using AMPS, or Advanced Medical Pricing Solutions. And so with that, we've got some early results that I want to share with you. We went with an open PPO network, so we're using PHCS for practitioners, and we have no network for facilities at all, so that we can RBR price all of our facility claims. The result of that has been we had 10 facility claims in January and February. We paid 24% of billed charges on those 10 claims. We're pretty excited about that. We think that represents a pretty good savings over what we were paying before. Currently, I'll have one other one that I'll share with you. In 2015, based on our population, we do a lot of joint replacements. Just think of that mature, aging male population that we have. And so in January of 2015, we did a bilateral knee replacement at a local facility in Durango. The bill charges were just over $100,000, and we paid about $85,000 of that. We just had a bilateral knee replacement, double knee replacement again, about 3 weeks ago. The check run was just issued last week. Bill charges were $103,000 at the same facility, and through our RBR pricing, we paid $34,000. So significant differences in terms of doing that. We still know that we've got some work to do in terms of managing the backside of that, in terms of working with those providers and what the balanced billing is going to be. We think we've got a great patient advocacy program in place with AMPS, and they're also handling some fiduciary responsibility with us on the back end of that as well. So with that, what's our plan cost now? Well, we're still using the high deductible plan. We're up to a $75,000 specific. Our aggregate's grown a bit, and our total expected plan cost this year is just going to be a touch over $1 million, and we've had about a 4% increase. So we're looking to be really excited about getting to the 1% that Cypress has. We're not there yet, but we're interested in partnering with Cypress because we think we've got an opportunity to get there. But I got to tell you, that 4% looks really good compared to the 20+% that we were doing in the first few years that we had. We still have work to do, and we also want you to know that the adventure begins on the train. Thank you.
And the adventure really begins on the tequila train, right? Isn't that what that's the... Most adventurous one. So do you get a sense of what's happening here? The most successful employers are the ones that are doing stuff, right? They're trying new things. They're making changes. It's not about raising deductibles and coinsurance and stuff like that. It's about bringing to bear the programs and services that are out there to help you reduce your healthcare costs. They've been successful because they've committed to doing that, and we're proud to have them as clients. And by the way, as we introduce our final panelist, all of these things that we're talking about here and all the things you're going to hear over the next day or so, talk to your account executive about it or talk to your salesperson about it. We've got the information for you. We can help you navigate through that. So our final panelist is Kim Nava from Goal Academy. They're based in Pueblo, Colorado. Actually, people who are proud to be from Pueblo. Good for you. Good for you. Kim's the director of Goal Academy, which is an online blended high school serving 4,000 students throughout the state of Colorado. It's a cool program. She's been with Goal Academy since 2010. This is her 16th year in human resources. And prior to her time in HR, Kim worked for QualMed, an HMO, so she knows our side of the business. And she was a billing specialist and reinsurance analyst. So please welcome Kim.
Thank you, sir. Hi. I was laughing because he said you have a fan club, and I'm like, just Drew, who happens to be from Pueblo. So as Tom mentioned, Goal Academy is an online blended learning charter high school. We serve about 4,065 students. When I started with Goal Academy, we had 23. So we have grown at a pace that has made me old, and that's okay. It's great work. We serve traditionally understood students, and really what that means is when you think about a conference room of teachers complaining about those 5 kids in their school, once they kick them out, they come to us. And so that is 4,065 students that are great and capable, and it's truly our responsibility to see that they become productive members of society. And that is truly the mission of our school, and what gets us to work on Wednesday when Tuesday really sucked. So we are designated as an alternative education campus by the Colorado Department of Education, meaning that at least 95% of our students meet one or more of the 14 high-risk indicators as deemed by the state. That means they're either a dropout, a teen parent, they have a history of gang violence or involvement, they are adjudicated by the state, or they are homeless. Goal Academy operates 32 location sites across the state of Colorado, ranging from Denver, and I'll give this one to Drew, Pueblo, Grand Junction, Craig, Pagosa, La Junta, Trinidad, Alamosa. So all over the state of Colorado. So the 275 employees that we currently have throughout the state of Colorado are literally all over the place. So we're trying to do this also in kind of a decentralized model. So that too in and of itself is an adventure. We do offer the following benefits to our team. We are a para-retiree employment association, which means that we have really great retirement, and that is for government agencies, public schools, school entities throughout Colorado. We offer 3 benefit programs. One of them is kind of that traditional PPO, a health savings account, and a bronze high deductible plan. So our employees have the opportunity to choose any of those plans that they see fit for their family. We offer a fully funded dental and vision and life insurance that includes short, long-term disability benefits. We have, in addition to para, we also have a 401k plan that is offered through the para Retiree Association, and we do a 5% match after folks have been with us for a full year. And we offer 2 employee assistance programs. And the reason we do 2 is because throughout the state of Colorado, there are some that are just a little more accessible than, the other one would be for the folks living in the South. So we became self-funded July 1st of 2012. So I've been with Cypress quite a while. I met Drew Rose Merrick during a meeting with our former broker, and we figured out that we both had worked for QualMed, and we began a kind of a relationship on that same day. So I've worked with these fine folks for a long time. And I'll just be completely honest with those of you that are considering Cypress or have been with Cypress. The reason that we have chosen to stay with them is because they were straight shooters. They were trustworthy. They gave you the cold hard truth, and I can always appreciate that. They also were not the cheapest, but they were honest, ethical, and funny. And funny goes a long way with me because insurance is not that much fun. In 2013, we chose to go forward another year with Cypress, but at that time, we did not have a broker. We had parted ways with our broker, and so the medical decisions we were making that year were not so bad because we had Cypress, and they, of course, had our back, but I luckily got to negotiate the other benefits all by myself, and I don't advise that. So if you don't have a broker, Andrea from Hub is sitting right there, and she is wonderful. So I would never do that to myself again. In July of 2012, our total plan cost was at $947,000. Our total COBRA funding was at $1 million. We showed a surplus of $91,780 with an enrollment of about 170 bodies. In 2013, we went up to right about $1 million. Our COBRA funding was at $1.2 million, and we were showing a surplus of $177,000 with our enrollment at about 180 people. In July of 14, our plan cost was $847,000. Our funding was at 1.1, and we showed a surplus of right around $280,000 with an enrollment of 167 people. What we started to learn about our data, and that is the coolest thing about being self-insured, is that you have an opportunity to look at your data. And really what our data was telling us is that we were fat, we were depressed, or we were pregnant. And sometimes all at the same time. So we were really, really trying to focus on how we were going to figure out how to help our employees. And one of the ways, that we're trying to do that, of course, is through wellness. But the other way is really if you can continue to keep those costs low for your employees, they will stick with you. In education, teachers want to know how many days off they're going to get a year, what benefits do you offer, and how much money they're going to be paid. And really, that is truly how you're competitive in the world of education. And so here's a little bit of our data to show you that we are one of those true living 1% increase kind of clients that they're talking to you about. So in 2012, our PEPM, per employee per month rates were about $464. In 2013, we were at $473. In 2014, we were at $422. And in 2015, we were at $471. And we were averaging right around that 1% increase that Tom spoke about. He didn't make that up. We also have a specific deductible that is at $40,000, and that is through HCC. Isn't there anyone here from HCC this year? No? They're really cool. We've been with them for 3 out of 4 of our years that we've been self-funded, and they've been very kind to us. We have added a transplant carve-out, and we did that year 1, and I think part of that came from my experience being a reinsurance analyst, and transplants scared me a lot, and Drew and I had a conversation about it, and Chris and I had a conversation about it, and we thought it would be a smart thing, and luckily, I believe it was year 2, Renee, we ended up having a transplant, and that transplant would have killed us financially. So having that little extra bit of coverage really, really saved us. So that was smart. Our actual plan cost versus budget was 77.4%, resulting in a surplus of approximately $161,000. The plan is currently running under expected at about 89.3%. Our total plan PEPM this year is 9% higher than the prior year of $444 versus about $407. Our enrollment has increased 6.6%, and it's trending like it's going to continue to grow. The large majority of our subscribers are using the employee-only coverage, even though we do offer that traditional 4-tier option. We have about 84% of our folks in the PPO, 92% in the HSA, and 89 utilizing that bronze higher deductible option. This year we had 3 large claimants that went over that $20,000 threshold, which is about literally 50% of our deductible of our specific, and we had 1 large claimant that went over. So that resulted, of course, in a reimbursement of about $6,000, and we weren't too concerned over that large claimant because it was kind of one of those one-and-done type procedures, so we don't foresee that being a huge issue. Going forward, really our cost control strategy is, now that we have the data, we need to own that data, and we need to figure out, how do you get the sad, fat, pregnant, depressed people happy? They don't have to be unpregnant because I don't want to get sued, but they can be pregnant, but they can't be depressed and they can't be overweight, and we can figure out a lot of great strategies to do that. And honestly, a lot of those strategies that I've learned over the years, I learned here at Cypress University. I think this is my 4th year, so I'm like a bachelor's level. And so I love self-insurance. I love our business relationship with Cypress. I do have the fiduciary responsibility every year to do cost comparisons with other TPAs, dental, medical, vision, because we're a public school, and so I have that responsibility. But I can tell you, I can't think of anybody in any other third-party relationship that I would rather be in this game with. I can pick up the phone and call any one of them, sometimes at the craziest time, and they will answer my calls, and they will explain things, and they are kind and they are timely, and in the world of insurance, that's really all you can ask for. So I do appreciate our partnership with them, and thank you all so much for listening to my story.